Good evening and welcome to Scotland at 7 here on Broadcasting Scotland. My name's Kenny McBride and joining us this evening from home is Ellen Hofer. Ellen, how are you this evening?
Hiya, I'm okay.
Good. Well, as of 2 p.m. today in Scotland, there has been a total of 15,895 tests for coronavirus concluded. Of those, 13,902 tests were confirmed negative, and 1,993 tests were confirmed positive. This marks an increase of 430 confirmed cases since yesterday, although this is slightly misleading as at least one of the labs wasn't working over the weekend, and therefore that 430 is an increase for them since Friday. The number of patients in Scotland who have died from complications caused by the coronavirus infection has sadly risen to 30. The latest UK figures available show that 1,789 patients who have tested positive for COVID-19 have sadly died from the illness. A total of 143,186 people have been tested, of which 118,036 were confirmed negative and 25,150 were confirmed positive. At the Scottish Government's COVID-19 media briefing today, after announcing these latest Scottish coronavirus figures, the First Minister went on to thank all NHS and care staff for their efforts. The focus of today's briefing was the Coronavirus Scotland Bill, which will be placed before the Scottish Parliament tomorrow. But before handing over to the Constitution Secretary, the First Minister made 4 announcements. Firstly, at the start of the coronavirus outbreak, the NHS in Scotland put in place a target to reduce delayed discharges by 400. This target has been exceeded already, and plans are in place to further reduce the number of delayed discharges and so free up much needed NHS beds. At present, there are 6% of NHS staff off work with COVID symptoms or self-isolating, and that number is expected to rise. As the new regime of key worker testing increases, the government expects to be able to manage the numbers off work more accurately and enable those who have been tested negative or who have recovered from being symptomatic to safely return to work. The coronavirus outbreak is having an impact on some local authorities' ability to meet the new childcare targets, and as a result, the legal requirements on local authorities to meet those targets have been relaxed. And finally, £1.5 million has been awarded to Scottish Women's Aid and Rape Crisis Scotland to help provide support to women and children who are at increased risk of suffering domestic abuse due to greater domestic stresses while families are at home on lockdown. And Ellen, we are going to discuss several of these stories in a bit more depth, but what do you make, first of all, of the testing figures and the news also about the state of the NHS right now?
I mean, we know from Italy that a great number of their doctors has passed away, so that's a huge issue. We're going to see more of that. One of the problems with not testing is obviously that we're not able to really say who has and who hasn't been through the virus at least once so far. It seems very much like my partner here at home has caught it, and for the last week he's been completely out of it, more or less. Very wheezy, very unwell, very knackered, just really groggy, and yeah, it's quite worrying because we're pretty sure he's a healthy person otherwise, and we're pretty sure that aside from the fever, which he doesn't seem to be having as a symptom, he's caught the virus, but nobody will include that in the figures. So it's quite worrying.
Yeah, of course, we have heard from the Chief Medical Officer that we may be looking at up to 50,000 positive cases in Scotland, compared to just about 2,000 confirmed cases. It's a pretty huge disparity, isn't it?
It is.
Yeah.
And, you have no idea of numbers that you don't raise.
Yeah, this is where big testing numbers are really going to have to become a much bigger part of the battle. On that coronavirus bill, though, due to be published, new powers and measures to help protect the public, maintain essential public services, and support the economy during the coronavirus outbreak have been published. The Coronavirus Scotland Bill was formally introduced before the Scottish Parliament today and will be scrutinised and debated by MSPs tomorrow. The bill focuses on three headline areas, making, firstly, adjustments to the justice system, including criminal procedures to ensure that essential justice business continues. A range of provisions designed to ensure businesses, consumers and public services continue to operate effectively, and adjustments to the law on evictions to protect those renting their homes in the private and social sector. The justice system measures include a power to allow for judge-only trials for the most serious cases, a power to design a programme of release for certain prisoners if needed, similar to the position in England and Wales, and other adjustments to criminal procedure, family law and civil justice to allow many hearings to take place remotely. Across the public sector, there are changes to the deadlines involved in planning and local authority licensing to reflect the fact that much of that business has been suspended and construction slowed due to the impact of COVID-19. Public bodies will also be allowed to simplify the ways in which they report their activities, including publishing information online for a temporary period. And to protect private and social sector tenants from eviction, the minimum notice period for tenants is being increased to up to 6 months, giving people peace of mind that their accommodation is secure. And Ellen, I think firstly we certainly have to welcome that news on evictions, being able to have that bit more security in their homes when people's incomes are so restricted has got to be a welcome bit of news, hasn't it?
I guess it is, but all of these things have a knock-on effect, and if we're honest, I mean, even if you look into the payment holidays for people who own their home, the payment holiday may be for the payment itself, but the interest still counts and makes a difference. You know, this will not be a free period. This is a period where we still rack up costs. Of course, it's good to see it extended, but again, council tax has not been dropped or reduced. At most, it has been postponed so that people at the end of a 3-month grace period will be landed with a bill that's even bigger. And there's nothing to say that in 3 months this whole thing is going to have blown over. Yeah,
and then there was this interesting thing about suspending jury trials for a time. This is met with some pretty significant criticism from lawyers and from human rights groups. What's your feeling about this? Is this something that has to happen to ensure that the wheels of justice can keep turning, or do you think we would be better to hold all these trials up potentially for months while we get to a point where we can safely hold jury trials again?
I think this is actually something that can be done with, transforming digitally how we go about things, and it shouldn't be taking months and months and months to do it. If you need all the people to be in the room as testimony is going to be read, you can do that. It's perfectly possible, so I don't see the hold up. Also, as somebody who in the last year was in the position of being a witness at a criminal trial and saw the trial never come to happen. The first appointment was delayed, and the second appointment, it turned out that the accused had fled the country. The process takes long enough as it is. The wait on these days when you sit in court is incredibly long, and the entire procedure is very lagging behind. Not to criticise the Scottish judicial system too harshly, but there's a lot of opportunity for overhauling, and this may be a good opportunity to do so.
Yeah, I mean, it's obviously it's not just to keep people waiting for a trial forever. I'm sure there are people who would be happy to get any sort of trial just to get it done. But as I said, there has been concern from legal voices about how big a change this is. There's also some changes in there on things like hearsay evidence in relation to what witnesses will be available for certain trials. It's all obviously this will be discussed tomorrow in Parliament. They're hoping to pass the bill within 1 day, which obviously poses its own set of risks. Whenever we pass legislation quickly, that can be a challenge. So we will obviously keep reporting on this, and hopefully we will also be broadcasting live from Holyrood tomorrow, so we will see what happens on that. And we'll discuss it again tomorrow at 7. But meanwhile, also amongst the First Minister's announcements today, the safety and well-being of women and children who are at risk of experiencing violence during the coronavirus outbreak is being supported with funds for key organisations. Grants from the Scottish Government's £350 million Communities Fund have been made to Scottish Women's Aid and to Rape Crisis Scotland to ensure that access to these key support services is maintained and victims still have access to methods of reporting crimes during the crisis, including using online video platforms, text messaging and phone calls. Justice Secretary Humza Yousaf said, "We want women and children experiencing domestic abuse in the home to know that although they may feel isolated and vulnerable during these unprecedented times, they are not alone. Anyone experiencing violence, including coercive and controlling behaviours, should not feel in any way inhibited by the current coronavirus to report a crime against them. These are enormously difficult times, but the safety of women and child victims who experience abuse in the home is paramount. The message to stay at home does not mean that they should not seek urgent help, advice and support." And Ellen, this is a very sensitive subject. Obviously, domestic abuse is a tough thing to tackle at the best of times, but at these times when people are being encouraged to stay in the house, when stress levels are high, when finances are tight, these are all things that are often seen as things that are likely to precipitate increases in domestic violence. What's your take on this new funding that the government has put forward?
I think the funding is important, and we have seen that the UK is not the only country in which domestic abuse goes up. In a case of isolation, you kind of have a captive audience, literally. I have to say that the case that I mentioned earlier, the court case that I was involved in last year, was a victim of domestic abuse, and that person was a male and not a female. So I think we all have a duty to start talking about this, not just in terms of gender, but just in terms of domestic abuse. Yeah,
there's one thing that we talk about very little, but there are a remarkable number of male victims. Clearly, the majority are still women, and the majority of the most extreme violence tends to have women as victims. So certainly the Scottish Women's Aid will come in very handy. What do you think about the question of how we kind of monitor these things, given that we are supposed to be isolating ourselves as much as we can? How do you think we can help people to know that there are supports out there other than by just government announcements and things like that? Is there anything you think that people in their own communities can do to help with this?
I think quite often the reports that come in, and again I'm speaking here about often also male victims who have a much harder time coming forward. I mean, coming forward is hard enough as it is, but male victims, because of the ostracization around it and the stereotypical it's a female victim with a male perpetrator, that kind of thing, it's often neighbours that witness a strange hubbub next door, and these neighbours are key people within their communities that need to help victims no matter what the gender is. And I guess it is for the police to go and check up on these reports. And in terms of coordinating responses, I've been involved with the village volunteer team when it comes to helping people through this corona self-quarantine sort of induced phase. And one of the things that is pretty clear is that not everybody has access to the internet, nor are they confident enough to use it. Sometimes all you can do is put cards for every single door. And that's what we did. Yeah, I guess we just have to remind people that the services are there, and that even though things are difficult just now, as the Justice Secretary was saying, people shouldn't feel that they're alone just because there's nobody physically that they can reach out to. Also, from the First Minister's briefing this morning, additional funding of £15 million will be provided to GP practices to help them cope with extra pressures arising from the coronavirus outbreak. Around a third of the funding
is intended to allow practices to remain open on Good Friday and Easter Monday if it is safe to do so, helping to alleviate pressures on out-of-hours services. The remainder will help to cover costs of equipment, additional non-clinical staff, GP partners and locum cover for sickness leave. Health Secretary Jean Freeman said, "I want to thank all GP practice staff for their incredible hard work throughout this pandemic. They're doing an invaluable job to keep crucial primary care services going in very challenging circumstances. Given the unprecedented situation we're in, I have taken the unusual step of asking GP practices to remain open on Good Friday and Easter Monday, but only if it is safe to do so. This will help to alleviate some pressure on our out-of-hours services." Working with the Scottish GP Committee of BMA Scotland, we have agreed a package of additional funding for GP practices to help them meet some of the costs of responding to COVID-19. Part of this will help to cover the cost of remaining open on Good Friday and Easter Monday, and the remainder will help to meet other costs being faced by practices during this difficult time. And with GPs, we've kind of talked so much recently about the pressure on intensive care, the pressure on hospitals. We sometimes forget that there is this whole primary care service delivered through GPs that still rumbles on. People are still getting sick of other things. People still have other injuries, other illnesses that they need to see a doctor about. Some GPs, of course, help with managing things like diabetes or asthma. What do you make of this new funding for GP services?
It's important. I think it's not just the GPs. At the minute, I'm seemingly going through a phase of my life where everybody around me and all social contacts seem to be either pregnant or have just given birth. And the number is truly astounding. There's like 10 people in my inner circle that are currently pregnant and about another 5 that have just given birth. And they have all been terrified of going even for normal checkups, obviously not wanting to do them at hospitals that are currently inundated. It's important to have additional funding, but there's also calls for other workers that are considered key workers, not just the NHS, which obviously is amazing and important and part of the calling that you take up when you go into these professions. But generally for key workers to receive an additional pay bonus to face these dangers and get on with their lives too.
Yeah. Do you have many friends that work in the NHS?
I don't actually. I have a couple of contacts, and especially my partner's friends. There's a lot of nurses, and whether male or female nurses, that are currently on the front line. In my personal circle, there is more people that work in other key professions, including workers that are working in supermarkets, and I can't tell you that I at least value them to the same degree as these health key workers, because their job has just become even more stressful for a ridiculously low amount of pay in circumstances in which most people and customers are not at their best. It's an incredibly stressful role.
Yeah, one of the things we've talked about here on the show a little bit has been how our understanding of what work really matters, what work's really valuable has changed so drastically during this crisis. People like supermarket workers, as you say, on the front lines, arguably in one of the most dangerous positions, because they're face to face with dozens, hundreds of people every day, and yet they're some of the worst paid people in the country. Same obviously goes for cleaners whose role has become so vital, and yet we pay them so poorly. Do you think this crisis is going to make a difference to how we view the value of some of these types of work?
It's quite interesting. Today, the Home Office has just decided to extend the working visas for all NHS key workers by another year. This is a process that has been previously been said to be incredibly complicated, and we can't do it at a snap of a finger. Look how quickly it can happen. And obviously the NHS and the health services are not the only ones benefiting from a huge amount of migrants working in these positions. I don't see a reason why, for example, a supermarket worker who is from a migration background should not have their visa extended, considering that the UK relies on them just as much as on nurses.
Yeah, absolutely. As you say, It's amazing how quickly some things can happen when a crisis like this hits, and indeed how much money can be found for it when suddenly it's decided that austerity doesn't matter anymore because there's a crisis that needs to be addressed.
Yeah.
Anyway, still in the health service, 92.2% of people attending A&E in Scotland were treated within the 4-hour target in the past week, during the quietest week in A&E in Scotland since weekly reporting began in June 2015. Commenting on the weekly statistics, Health Secretary Jeane Freeman said, "I want to thank Scotland's health and social care staff for their work to continue providing an exceptional level of care during these extraordinary times. The number of attendances to A&E this week was the lowest on record since weekly reporting began. This is due in part to people heeding our advice to access the most appropriate service during the COVID-19 outbreak and only attend A&E if your illness is immediate or life-threatening. I also want to thank the public for their support as the Scottish Government continues to work with health boards and partnerships to ensure robust plans are in place to strengthen capacity and minimise the impact of COVID-19 across the health system. It's important to follow advice to stay at home unless it is essential to go out. By doing this, we can all help to reduce the spread of coronavirus, protect our NHS, and save lives." And I thought obviously the 92.2%, that's slightly below the target, but about what we've come to expect from this. Still excellent numbers. But I was impressed by how few people are attending A&E as opposed to say calling 111 or calling the out-of-hours GPs, or trying to find other ways of treating their illness or their condition rather than immediately rushing to A&E. Do you think this whole process is going to change how people interact with the NHS more generally?
You should think so. You should hope so, because this whole going to the A&E instead of seeing your GP is not a new problem. It's in fact something that I've heard about since I first turned up in the UK over 15 years ago. That the A&Es were inundated with people who are coming for a broken toe or whatever. Thinking it was something like that, but not having checked with their GP and just going by their own pain levels. And, you feel like you're best served by your hospital, where, of course, the irrational conclusion is that if everybody goes because they believes the best care is in the hospitals are not able to provide the best care for anybody because they're inundated with patients. Mm. So I'm fairly cynical at this point. I think all of us are becoming more cynical. The longer self-isolation goes on, the harder it is to keep positive in many ways. But I still believe that this is an excellent opportunity for us to transform the way we do things in a lot of ways. And I hope that includes a change in consumer behaviour.
Yeah. And in health research, an Oxford-based firm that uses artificial intelligence to develop new medicines has teamed up with a UK National Science Facility to screen more than 15,000 drugs for their effectiveness as a treatment for COVID-19. Exscientia, a spin-off company from the University of Dundee that's now based in Oxford Science Park, said it had gained access to a large collection of existing drugs held by the Scripps Research Institute in California and funded by the Bill and Melinda Gates Foundation. It will screen them in partnership with Diamond Light Source near Oxford, which works like a giant microscope and generates bright light that allows scientists to study viruses. Exscientia hopes to discover a drug that can be repurposed to treat coronavirus within the next 6 to 12 months, whereupon it would be tested on COVID-19 patients. Professor Andrew Hopkins, the firm's chief executive, has told The Guardian. Any potential treatment could be made available for compassionate use before clinical trials are completed, but this would depend on how much can be manufactured quickly. The drug collection, which comprises more than 15,000 compounds that have been approved and tested for human safety in clinical trials or preclinical studies, has been shipped from California to Oxford. And Ellen, this is something we've seen from a couple of different organisations, this idea of using AI to tell which compounds, which drugs might be the most useful in treating a disease so that we can then focus very closely on those for trials rather than having to work from scratch the way drug development did in the past. What are your thoughts on this kind of scientific breakthrough?
I mean, I have no idea about the science behind this, but whatever we have should be thrown at this problem, because at least we have vaccinations for flus, but we don't have a way of managing corona other than the way in which we are handling it at the moment. And that obviously is a very limited way of effectively, stopping the transfer from person to person, but it also completely shuts down our economies and day-to-day life. So whatever approach we can find is important. I'm not sure if you came across the article about I believe it was a 27-year-old or 28-year-old Australian who tried to invent a sensor for you not touching your face, in the process of which he managed to get magnets stuck up his nose. So when I say we should be trying and tackling any route, maybe we should be leaving some of this to the people that can safely handle magnets. But generally speaking, I think it's the right idea. We should throw whatever we have and the kitchen sink at this and try to go hard, because clearly there's not an economy that is not impacted by it, and that doesn't want this problem resolved.
Yeah, and we saw the other day a university teaming up with the Mercedes F1 team to produce these new mask ventilation systems. We've seen discussions in the States of similar sort of AI developments to analyze the virus and the drugs that might treat it. We've seen similar research, in fact, at Glasgow University. And once again, we're seeing things moving at incredible speeds because we have this crisis. Now, obviously, not all medical research can move at this pace all the time. But do you think there is a place for maybe better cooperation between industry, between universities, and the government in providing funding to show that we can actually move some of these things forward a lot faster than we do in normal times?
It is possible. I think that's actually a really good example over here. I don't know if you've seen these things before, but they're meant to be visors that have a sort of acetate clip that comes across here. Mm-hmm. These are 3D printed on our home 3D printer. And that seems to be going on all over the place. The level of involvement that you can get from the community in asking properly for people with the right resources to assist in whatever problem you're facing. It's something that we're, as a society, very poor at so far. I like to, or I don't like to think of it, but it is true, I believe, that we are trained from the way that we are raised and brought through schools, that you're not meant to copy from each other's task sheets. You're not meant to copy answers from each other, but both global warming, climate change related issues, as well as these emergency situations that affect the entirety of society, require us not to be, individually performing as good as possible, but we need to copy from each other's sheets. We need to help out with our resources where they're most appropriate and give our own.
Yeah, I think there may be some interesting developments when it comes to how we research and how we share information. If we can bring some positives out of this, there may be some positives to take from this crisis on that front. Meanwhile, in your home country of Germany, German scientists have announced what they describe as a first-of-its-kind study into how coronavirus spreads and how it can be contained, using the country's worst-hit district as a real-life laboratory. The virus has spread more widely among the 250,000 residents of Heinsberg, a district in North Rhine-Westphalia bordering the Netherlands, than anywhere else in Germany, with 1,281 confirmed infections and 34 deaths. More than 550 people have recovered from the illness there so far. The advance of the virus in Heinsberg is between 2 to 2.5 weeks ahead of the rest of the country. Over the coming weeks, the district will be used by leading virologists and a team of 40 medical students as a sort of laboratory for studying the virus. The COVID-19 case cluster study, launched this morning, will follow 1,000 people who have been chosen because they are representative of the German population as a whole. The results will be used to create a blueprint for how Germany might deal with the virus over the next few years, said Professor Hendrik Streeck, the head virologist at the University of Bonn. This is a big chance for the whole of Germany, Streeck told a meeting of parliamentarians that was streamed live on television. We'll be gathering information and practical tips as to how to deal with COVID-19 and how we can achieve further containment of it without our lives having to come to a standstill over a period of years. and this is quite an interesting type of research. There's obviously all manner of research going on all over the world, but this of looking at how a community has spread it. What do you think of this kind of study that's going on in Germany?
It's interesting. It's especially interesting because I grew up in North Rhine-Westphalia, and my ignorant mind, I haven't really, to be honest, kept up with the spread and what's going on in Germany in the last couple of weeks. But I'm surprised because I thought the oven of where it is most intense was southern Germany, around Bavaria. I'm a bit shocked that it is in North Rhine-Westphalia. It's good to do these studies. We need to know these things. We haven't really faced something like coronavirus in a long time, if at all. So the more information, the better. And it's interesting to look at the methodology. At the minute, I feel like the UK is kind of at best copying what's going on somewhere else, but not taking its own steps. I believe a couple of days ago there was a report about one of the big German drug companies, I think it was Bayer or something like that. They are developing a broad spectrum test that allows to test for both coronavirus but also for different flus and other infections, and the development time of that test is meant to be 2.5 hours rather than 24 hours or more. So it's interesting to see how fast the response to this can be if there's investment in it and motivation behind it.
Mm-hmm. And Germany has had a lot of praise. Obviously, its testing regime has been way, way in advance of what we've managed here. And partly as a result of that, but partly as a result of just what seems to be a better managed crisis all in all, their death rate seems to be significantly lower than what we've seen here. What's your feeling about why Germany has managed to get so far ahead of the curve on testing compared to the UK?
I have no idea. I have feelings about it, but I have no scientific answer. I believe that Germans do have a greater emphasis on the average person on the street having a basic level of common sense and education that is kind of not as socially required here. I also think that Germans trust their government at least a little more than we do in the UK. I believe that we're quite good at organizing and having rigorous responses, and logical, progressive problem solving seems to be one of the things that Germans and Germany just does really well. And then you look at the numbers of deaths compared to the population that has become infected, and there is no way around it. The health system there just is superior. They are better equipped. They are better prepared. One of my parents has been diagnosed with coronavirus as well, so at the minute I'm feeling a bit cut off from my family, but I am absolutely sure that she will be fine. She receives the best treatment. The biggest concern with her illness at this point is that she leads several dozens of disabled people's homes in her county, and she's not the only one in the management level that has been diagnosed. About 95% of the people in the management level have been diagnosed with coronavirus, to the point where my father had to get involved for going to individual shops and picking up toilet paper in order to service the homes and accommodation for these disabled people, because there's no, there's the leadership is missing.
Yeah.
So that's a huge issue, but we can see pretty clearly that our health system, as much as we love the NHS, in many ways is underfunded and underprepared, and vulnerable.
Yeah, certainly Germany's ICU capacity is massively bigger than what we have anywhere in the NHS. And as you say, it does seem that the preparation was a bit better, and that the overall response from the government has just been much clearer. There has been obviously criticisms here about mixed messages from government, which we're not going to get into tonight. But certainly we could I'm sure you could spend a long time complaining about those things if I let you have a live mic. Anyway, moving on to another country, the US. The US's death toll from the coronavirus pandemic climbed past 3,000 yesterday, the deadliest day yet in the country's crisis, while New York cheered the arrival of a 1,000-bed US Navy hospital ship as a sign of hope in the city's increasingly desperate struggle to contain the virus. Total deaths across the country reached 3,017, and total cases are now thought to number over 160,000. New York City is still by far the hardest hit region of the country. The hospital ship, the Comfort, is expected to treat patients not infected with the virus, thus lightening the load on other hospitals in the city. A field hospital is also being established in the city's Central Park and should begin receiving patients today. New York State Governor Andrew Cuomo has received plaudits for his leadership during the crisis, such that some are now listing him as a potential presidential contender in November. He has sought to depoliticize his responses, but he has still thrown sharp criticisms at President Trump's failure to deliver adequate supplies of ventilators and protective equipment for healthcare staff. Trump himself does now appear to recognize the scale of the crisis, warning of up to 1 million dead if Americans do not heed advice on physical distancing. Dr. Deborah Birx, head of the White House coronavirus task force, said, "If we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities." And there's somebody that I'm sure you have a few things to say about as well. Donald Trump's performance in this crisis has been criticised from almost everybody who's had anything to do with it. What's been your take watching from this side of the pond?
If you were trying to choose a person to lead you through a crisis like the coronavirus, in the UK or in the US, I don't think at the minute we have our wish candidates, our ideal candidates to navigate us through. And from that point of view, I believe many of the pieces of advice that have come out of Number 10, but also out of the White House, have been dangerously uninformed and unhelpful in terms of managing what is being done and what needs to be done. I think the number that you mentioned, between 100 and 200,000 people in the US passing away if everything goes perfectly, is extremely optimistic.
Yeah. Trump, of course, at the beginning of the crisis kind of waved it off, said it's nothing, it's not going to be a big deal, it's just going to magically disappear one day. What do you think the reasoning behind this is? We've seen a lot of his circle talking about the effect on the economy. And, for example, I think it was Lieutenant Governor of Texas saying that it would be worth it. Older people would be willing to die to leave their grandchildren a better economy. Clearly, I think most of us would have some problems with that. Do you think the weak leadership that we've seen in Britain and especially in the US has partly been led by this concern over putting the economy first?
It has. I think coronavirus is a very, very interesting case, because I believe that Donald Trump will be scared of what it means for him. Not only is this a very limited crisis in terms of it's just his territory, Simba as far as the eye reaches, as far as the shadows go, it actually is a global crisis. And because of this, it will be perfectly possible to compare the response and the leadership and the steps taken on the way to a response very easily with other countries, in the same way that we've just done with Germany and the rest of the world. There's hard facts, and these hard facts are the lives and deaths of people. So this is going to be very hard to sweep under the carpet in a way that almost no other issue, current issue, is. Another thing that affects the whole world is global warming, but because we're all in the same boat and all take the same measurements, if you're a climate denier, it's quite easy to go, well, this is just what it is, and it doesn't really make a difference. If it comes to people dying and people falling ill, it's much harder to wipe that away. And if you are a weak leader who's got there by trickery, money, and a lot of elbow rubbing with other people, this is something very hard to put into the realm of, I don't care, it's not my problem because I am the best ever. It's very hard to do that with something that has such hard, tough and cold facts behind it.
Yeah, and we've seen something like I think there's still about 20 states in the US that don't have any official lockdowns in place. Some governors have been kind of pushing it down to their counties and asking county authorities to make decisions. Obviously, the Constitution puts some limits on what the federal government can do in these situations, but do you think there is a place for the federal government and for Trump in particular to be pressing harder on these issues, or do you think the way these levels of government work, is better for him just to take a step back and let the states and the counties do things on their own?
It's an interesting question. I think it's a similar issue that we have here. Is it something that should be led entirely by the UK government? Should the devolved administrations take more responsibility, or should it even go down to the council level? At the village response meeting for our area, we found that one of the people from South Lanarkshire Council had been there, and the most positive thing that was said the entire night was that she said, as a council, we have decided we will throw whatever we have at this problem. We will not worry about money or time. We will worry about that later. But for now, we're doing everything that we can to get our county through it, our area through it, and there is need for all of these different levels of responsibility of government to play their own part. I think in general we have learned that local government should have a much greater ability to have influence on the political ongoings, and so that is important. It's very hard to bring down blanket decisions over areas that are just not the same. It also really varies. I mean, somebody in the Highlands will be differently affected than somebody living in the middle of London, for example. So I think in the US it's quite similar, but there is a role for federal government, and that is in providing resources and opening the paths to these resources. If it's information or if it's materials, these paths have to be open for people to access them where they're needed.
Yeah. And back in Europe, a 12-year-old girl died in Belgium of the coronavirus, a spokesman for the Belgian Health Ministry said today, and local media have reported that she was Europe's youngest victim of the disease. It's a rare event, but one that devastates us, virologist Emmanuel Andre told Belgium's official daily news conference on the spread of the disease. The European Centre for Disease Prevention and Control, an EU agency, has also recorded deaths in the age range of 10 to 19 years in Spain, but did not provide details. While the COVID-19 respiratory disease caused by the virus has affected the elderly more, the girl's condition deteriorated after 3 days of fever, Belgian officials have said. The officials did not provide details on whether or not she had any previous medical conditions at the time. Overall, Belgium's death toll rose by 98 to a total of 705 people on Tuesday. The country reported 876 new cases of COVID-19, bringing the total number of confirmed infections to 12,775. Some 4,920 people were hospitalised, meaning around half of the medical services capacity was taken up by coronavirus patients. Belgium expects the spread of the virus to peak in the coming days and weeks. And Ellen, I mean, this is obviously tragic news, a 12-year-old girl losing her life in Belgium, but just an example that it's not just the elderly that are dying from this. There are people of all ages becoming very seriously ill, and in this case, obviously, losing their lives. What do you think we can take from this kind of news?
It's very difficult to say what we can take from this. I'm a bit confused because my partner is really very seriously unwell, and we showed symptoms at the same time when we both fell ill, but I recovered very quickly. And while I like to think that I win every game and that I'm, superior at nearly everything, I don't really understand why he is so badly affected by this. And I'm living with him, and, we share everything. And he is in such a worse state. It's very hard to predict how people will be affected and why this is. And I guess this is why we're doing so much research into trying to find out how the population is affected.
Yeah, it's been a very, very interesting thing to watch. And I mean, speaking for myself, I have diabetes. I'm theoretically in a relatively high risk group, but I have friends with diabetes who have been fine. I mean, they've had the virus. It's pretty much run its course. They seem to be doing okay. But then we hear of people with no pre-existing conditions who have suffered really, really badly. Clearly, there's other factors at play. We just have, as you say, with like the likes of this research that's happening in Germany, hopefully that can start to show up some of the other risk factors so that we can predict better who might be at severe risk and hopefully improve treatments from there. Moving on though, homelessness has become a hot topic worldwide in the wake of the coronavirus crisis after images of homeless people sleeping in a converted car park in Las Vegas sparked criticism of the city's response. Over the weekend, authorities in Las Vegas needed to find additional sleeping space for the city's sizable homeless population when a 500-bed overnight shelter closed after a client tested positive for the coronavirus. Officials turned a parking lot into a makeshift shelter, saying spaces for sleeping were drawn 6 feet apart in observance of federal social distancing guidelines. This has been described as an emergency situation that would soon be resolved, but has highlighted a problem that affects most major cities around the world. Critics, including former presidential candidate Julian Castro, have pointed out that Las Vegas contains around 150,000 hotel rooms, which could easily accommodate the homeless population. Meanwhile, in Europe, different cities are handling the crisis in different ways. In Amsterdam, many shelters have been closed down during the day, forcing homeless patrons to wander the streets until evening. In Paris, homeless people have been herded into gymnasiums to prevent crowds gathering outdoors. Meanwhile, food services for homeless people have been badly affected by a lack of protective equipment for workers. In Prague, workers described tearing up strips of fabric from home to create makeshift masks to enable work to continue. And in Italy, police have reportedly been issuing fines to homeless people for failing to meet lockdown requirements. Advocacy organisations have begged for leniency, making the rather obvious point that people can't stay at home if they don't have a home in which to stay. On any given night, there are around 700,000 people sleeping on the street or in temporary shelters across the EU and UK. This is a 70% rise over the last decade, and numbers continue to rise in every country except Finland. And, Ellen, I'm sure those pictures from Las Vegas will have been as distressing to you as they were to so many of us. But the response to the homelessness crisis has been patchy pretty much everywhere. In fact, Britain and London especially has actually done very, very well, and they have requisitioned hotels and just put people in to wherever they could get a room for them. What's your take on how this has affected other cities and other countries?
I mean, the reality is, if we want to end homelessness, we need to make homes available. And this is not just the case during a crisis like the coronavirus crisis. It's the case at all times. That still doesn't mean that you'll get the entire homeless population off the street. There are several factors that lead to people being there in the first place. And sometimes it's not just having a home available. But it's the very basic first step. If you just look at the pictures that we just saw from Las Vegas, 6 feet seems like nothing. I've seen people distancing far more. If you left one of the spaces in between each of the people sleeping in that parking lot, that might be slightly more safe. But that it's just a ridiculous concept that a city with so many hotel rooms would not make them available, not requisition them to serve a population that is clearly at high risk of medical emergencies already. It's absolutely unbelievable. Same goes for Italy. I mean, telling homeless people that they should be at home. No, Sherlock, it's unbelievable that this is how we decide to respond to that crisis. I don't really have words. All I can say is, yes, what we're doing now, if we manage to find a good response to this situation, that response should be transferred to after the crisis. We should make it available.
Yeah, it does kind of seem that if we can get everybody off the street that quickly, when it matters for the health of the whole country, to avoid there being a reservoir of the virus in the homeless population, then it should be possible to do it any time, shouldn't it?
Absolutely.
Yeah. Anyway, and our final story, still on medicine, but not on the coronavirus, thankfully. A new blood test that can detect more than 50 types of cancer has been revealed by researchers in the latest study to offer hope for early detection. The test is based on DNA that is shed by tumours and found circulating in the blood. More specifically, it focuses on chemical changes to the DNA known as methylation patterns. Researchers say the test can not only tell whether someone has cancer, but can also shed light on the type of cancer they have. Dr. Jeffrey Oxnard of Boston's Dana-Farber Cancer Institute, part of the Harvard Medical School, said the test was now being explored in clinical trials. You need to use a test like this in an independent group at risk of cancer to actually show that you can find the cancers and figure out what to do about it when you find them, he said. Writing in the journal Annals of Oncology, the team reveal how the test was developed using a machine learning algorithm, a type of artificial intelligence. Such systems pick up on patterns within data and as a result learn to classify it. The team initially fed the system with data on methylation patterns in DNA from within blood samples taken from more than 2,800 patients, before further training it with data from 3,052 participants, 1,531 of whom had cancer and 1,521 of whom did not. The team then taught the system which groups reflected which type of cancer. And again, and this reflects something we were saying a little bit earlier about the use of artificial intelligence in developing new medical treatments, new medical tests. What's your thoughts on this kind of thing that might be used to screen for up to 50 different types of cancer?
I think this is exactly what big data is meant for. This is what it can do for us. There's many scary things that it can get up to with data that we don't know about, but this is clearly healthcare is one of the areas where that kind of diagnosing is a huge step, and one that we just don't have yet, one that isn't being reliably hasn't been mastered in any other way. So for us to analyze all these results per person by hand, on a sheet of paper, and then we developed it into a, human-powered computer algorithm, from that to AI, which, independently goes through all the results and then analyzes what the output of that is and what it means in terms of transferring a pattern from one set of data to potentially new patients. It's amazing what can be done with this sort of technology when it comes to healthcare, and that's what we should be using it for. This is one of the few areas where very little concern about big data.
Yeah, it's if it can be used to catch early, do early detection of cancers, then that can only be a positive thing. It's always easier to treat cancers if we have early warning of them. Sadly, that is all we've got time for. I would like to thank you, Ellen, very much for joining us. It's always a pleasure to see your face, and the very best, obviously, to your partner and to your mum. Hopefully, they both get well very soon. And to those of you joining us at home, thank you very much to you as well. It's not worth putting these programs on if we don't have an audience, so we are very grateful to have you. If you're able to support us, we would love to have that support. We know times are tough just now, but if you do have a few quid to spare, then please go to broadcastingscotland.scot/register. If you sign up as a supporter there, your £5 a month can make a huge difference to what we're able to do here at Broadcasting Scotland. We're always trying to expand the range of programmes we produce, and there are a couple of things in the works right now on that front, so every penny counts. We do appreciate, though, that obviously not all of you have a lot of money to spare, especially not right now when the corona. So if you're not able to support us financially, please don't worry. The shows will always be free to view online, but you can help us a huge amount by following us on Twitter at Broadcast Scot, by finding us on Facebook, and by sharing the show around with your friends and family. Every bit of marketing that you can do for us, everything you can do to help people know that we're where we are and what we do makes a big difference in helping us to build our audience. And also, we're always looking for volunteers as well. Even without coming into the studio, there is a lot of that you can do to help, whether that's as a journalist, whether it's preparing graphics for us, or whether it's helping us develop some of these other shows that we are trying to develop. If you've got any interest in broadcasting, any interest in journalism, then there are definitely roles for you here. Just get in touch through the website or through social media, and we would be delighted to hear from you. And we, as you can see, we have been able to broadcast remotely. So if you're thinking of becoming a broadcaster, or if you have things to say that you think you might be a good guest to come on the show, then please do get in touch with us. We are perfecting our remote broadcasting techniques as we speak. So you are more than welcome to join us if you think you might have a role as an on-screen figure as well. So do please get in touch with us. But that is all we've got time for tonight. I'd like to once again thank Ellen Hofer for joining us. As I say, it is always a pleasure to see her. And I'd like to thank you again. Gordon, I will be back tomorrow night at 7 with another Scotland at 7. But until then, please do look after yourselves and have a great night.